Assalamualaikum and good morning, ladies and gentlemen. My name is Ratna Kartika from Department of Internal Medicine, Faculty of Medicine, Dr. Sutomo Teaching Hospital, Airlangga University, Surabaya, Indonesia. During this opportunity, I would like to present our study, Prevalence of Obesity and its Impact on Outcome in Patients with Mild to Moderate Case COVID-19 in Indonesia. In March 2021, WHO has recorded more than 100 million confirmed cases of COVID-19, with more than 2 million deaths. In Indonesia, our current number has reached more than 1 million cases, with more than 36,000 deaths. Obesity, based on previous research before, makes individuals more susceptible to exposure of COVID-19, and also with worse clinical manifestations. It may be due to the occurrence of chronic inflammation that interferes with the immune system and subogenic response to pathogens, and as well as impaired lung function in obesity. The objective of this study was to describe the data of demographic profile as in gender, age and occupation, comorbidities, clinical manifestation, severity, also clinical outcome of COVID-19 patients with obesity. The study designed as descriptive study where all data taken from electronic medical records by time May 2020 to February 2021 in Indrapura Forefront Hospital, Surabaya, Indonesia. The population of this study, all COVID-19 patients with obesity that hospitalized in Indrapura Forefront Hospital, Surabaya, Indonesia, using purposive sampling technique. The inclusion criteria of COVID-19 patients with obesity that hospitalized in Indrapura Forefront Hospital, Surabaya, Indonesia, male or female, age more than 18 years old, with the only exclusion criteria patient with incomplete data of their electronic medical records. The results and discussion. In our study, we have 1,738 patients in total, with around 45% as women and the rest are men. In this study shows that the average age of obese patients is relatively young, with the mean age around 33 years old. With the most occupation of our patients is self-employed or private worker. And during a pandemic, restriction on community activities may lead to uncontrolled eating patterns and reduced physical activity. Obesity may lead to metabolic syndrome and induce chronic low-grade inflammation, so that obese individuals may become more vulnerable to many infections, including COVID-19. 79% of our patients have no other comorbidities than obesity, but 10% of them also have hypertension as a comorbid, followed by diabetes mellitus, asthma, and also cardiovascular disease. Obesity itself is associated with increased risk of diabetes mellitus, hypertension, and cardiovascular disease, where the greater number of comorbidities in obese patients, therefore increasing the severity of COVID-19. This study result has similarity to the other previous studies that says that hypertension leads the comorbid in the obese group, followed by diabetes mellitus and also cardiovascular disease. Test out symptoms of obese patients with patient COVID-19. In this, the COVID-19 can appear as asymptomatic at first, especially for those at younger age and without comorbidities. Or the symptoms may appear later, range from mild to critical condition. Almost 50% of our patients were appeared asymptomatic at first, but as we can see in this figure, 25% of our patients has cough as their main symptom, followed by with anosmia and also fever, also runny nose. Our results are in accordance with a study in Shenzhen, China on July 2020, where most patients with obese have more symptoms of cough compared with patients with no obese as comorbid. Based on disease severity, we have 4 disease severity from asymptomatic to severe. from in our study shows that more than 52% patients would be classified as moderate COVID-19, followed by mild COVID-19 and asymptomatic COVID-19. Another study in France exhibited the risk of invasive mechanical ventilation in patients with COVID-19 infection was more than 7-fold higher for those with body mass index more than 35 kilogram meter compared with the one with BMI less than 25. The outcome in obese patients with COVID-19 in our study, and more than 90% or up to 97% in our study are discharged successfully from our Indrapura Province Hospital. The Indrapura Province Hospital Surabaya manage all patients with oxygenation and asymptomatic therapies without antiviral nor antibiotics. Compared with another study in United States, the obese patient with COVID-19 in our study has lower risk of in-hospital death or mechanical ventilation requirements. Similar to several previous studies, our study showed that obese patients with COVID-19 did not increase the risk of hospital mortality. As a conclusion, the obese patient who experienced COVID-19 infection experienced moderate degree of COVID-19 as the most biggest percentage, followed by severe COVID-19. Most of the patients had good outcomes and were discharged with negative RT-PCR out of the therapy given during the treatment at the Indrapura Hospital were supportive therapy and specific treatment to patients with underlying medical condition or comorbid. Only 2.1% of patients were being referred to another hospital with more appropriate facility due to the severity of the patient condition, and only one patient died with cardiovascular event as the mortality cause. In the study, the conclusion, obesity does not always seem to predict for clinical evolution in patients with COVID-19. Thank you. Wassalamualaikum warahmatullahi wabarakatuh.